I think, Kashyap, the real issue here, I think Lee has gone and done a very nice job of talking about kind of the FDA approval process for biosimilars and how biosimilars differ from reference biologics. The real issue is for us is kind of, can you walk us through kind of how you in the COA and ION and your own individual practice adopted biosimilars, and kind of how did you go through that? There must have been kind of a difference between all the three ways of doing it.
Oh,
three different roles
absolutely,
you had.
Adam. And before I begin how we moved into that, my passion for biosimilar has arisen since I see that as the only possible logistical solution to address Part B drug price. Every time we go to the Hill, we go to Senate and Congress, we get asked by senators, are you interested in working with us in reducing the drug price? And I see biosimilars as one of the only lifetime opportunity of reducing the cost of care when we look at the potential for savings of the biosimilars. Now let me look at the system-wide. So International Oncology Network and Community Oncology Alliance, these are the two different large associations. One is the business group, the second is not-for-profit advocacy group. They both have put their full force behind supporting biosimilars, again, understanding that if we want to address drug price, this is a way to go. And at individual level, at our clinic level, being one of the oncology care model sites and the alternate payment model sites, we chose to adopt biosimilars the moment they are approved, and we've assimilated them very quickly into our practice. It's not been an easy journey, though. I think with the multiple issues with the payers, multiple different companies coming back with the product. So it's been a journey, but I think we've been able to integrate biosimilars substantially within our armamentarium of tool to help address drug price.
So, the first question, so let's start with ION. ION is a large purchasing cooperative.
Correct.
And so what were the issues, for a large purchasing cooperative? I'm sure they're different for like individual clinics. What were your issues in adopting it?
So at the ION, the first thing we were concerned about was the education, and I did multiple educational events at the ION at national meetings, and I was quite surprised, unpleasantly, to find that most of my colleagues did not even know the difference between the generics and biosimilars. So it took us about almost a year and a half to two to go for educating my colleagues at the system-wide as a GPO or group purchase organization. And then started challenges of the payer coverage, of the regional variation, of the contracting by the state Medicaid. So we had to form a biosimilars committee, which I'm chairing for the ION as well as for the COA. And we do feel that by bringing education for the physicians, for the payers, for the pharmacists, and for the patients, we definitely can start surmounting the challenge of getting biosimilar adoption.
So who really are the decision makers? So you have, we'll get into this in a minute, but I'm going to talk in a few minutes about if you have several biosimilars in the same class of drug, like several biosimilar trastuzumabs, for example. We're going to talk in a minute about how you decide which of the five or whatever to do. But before we do that, I'm really curious, who makes the decisions then at the ION level? Does ION decide we're going to purchase this one? Of the five? How do you do that? Who decides?
So ION tends to be agnostic of the manufacturer. I think they want to work with all the manufacturers who are willing to work. And there's going to be regional variation based on the payer coverage. So ION probably has to be more like a Switzerland, but at least they encourage all the manufacturers to have a expected supply chain so that there's no issue about supply, there's no issue about the quality. So ION's role is to help steer the contracting piece, and then they leave it to individual practice about how they want to work with the suppliers.
So ION will contract with everybody?
Absolutely.
And you have a committee that decides, like, okay, we believe this or you just, whatever the biosimilar is, you'll take it, or do you have certain kind of characteristics that you would use in ION to say, we're not going to contract with this person, but we are with this? Do you do that or no?
We typically don't do that, but I think ION's committee sits down every 6 months to look at the contract. Essentially, it's based on the contract.
Got it.
It's, the predictability of supply, and also are they willing to work with us? Because sometimes a manufacturer may straight away go to the payer and say, we want to have our drug. And so that complicates the issue. So ION's role, again, is to break down the barriers for adoption of biosimilars, understanding that even though if you look into ION may be at a loss because if they're making quite a point or a point on each purchase that they do through the GPO, the less expensive the drug is, the less profit that they take. But still, in the holistic view of society as a whole, ION has chosen to go with supporting biosimilars as a part of social responsibility.
Right, but anyway, the bottom line is, but you're going to use, like, if there are 5 different, I think there are 5 different biosimilar trastuzumabs. Again, I'm familiar, being a breast guy, I'm familiar with that. You know, so you'll say, okay, we will contract with all 5 of them, and it's going to be up to the individual purchasing physician to make that decision.
Exactly. So ION will make sure that if a physician in Pittsburgh wants to buy A drug, a group in South Carolina wants to buy B drug, they want to make it available. And again, because of the contracting variation.
And COA, is that any different, or is it pretty much the same thing?
So Community Oncology Alliance role is totally being agnostic. Our role at COA is just to make sure that we bring every toolkit for our team's colleagues and also work with the payers to help them understand relevance of the biosimilars in addressing Part B drug price. So COA looks at it a lot more as part of what we call steward or trustee for the society, and we want to do everything possible we can to reduce the drug price in conjunction with the government, Senate, Congress, and payers.
Got it.